Hi everyone. So welcome to our channel Medico Prime Education. So in today video lecture, we are going to study the blood supply of bone. So blood supply of bone, what we have to remember in this topic, basically which artery supply the bone. Okay, where does the bone get nutrition? How bone gets nutrition? Okay, so this is the main overview of this topic. So for finding that answer, we study the blood supply of bone. So here you can see the uh, a basic long bone. You can see the one artery piercing it. This is known as nutrient artery. And this nutrient artery, one of the branches goes upward and one of the branches goes downward. Okay. And after that, it anastomoses with another artery known as metaphyseal artery. So metaphyseal artery, here you can see the metaphyseal artery in the metaphysis. Okay. This make the one type of anastomosis here and supplies the all parts of the bone, so the branches of the nutrient artery. So what is nutrient artery? A artery which enters through the nutrient foramen is known as nutrient artery. Okay. And after that it gives the branches known as periosteal artery which supply to the periosteum. This is known as periosteum. Okay, so all these arteries we are going to discuss one by one in the coming slides. So first of all, we will discuss the in two sections. First, we will discuss the blood supply of long bone, okay, and for another blood supply of the short bone. Okay, we will discuss in the next slide. First, we will come to the blood supply of long bone. I will go through all the slides. First, let me summarize here all these things. After that, you can see. Okay, so first of all, nutrient artery. So long bone is supplied by the four types of artery. What type of artery? Long bone is supplied by the nutrient artery, nutrient artery. Next is metaphyseal artery, metaphyseal artery. Next, it is supplied by the epiphyseal artery, epiphyseal artery. Okay, next is periosteal artery. So from that four artery, long bone supplies get supplied. Okay, so from these four arteries, nutrients are provided to the long bone. Okay, next short bone is supplied by the only two artery known as nutrient arteries also. Okay, and next is periosteal artery. You know the short bones. I have already discussed the types of and classification of bone in the previous lecture, so you can go through that. So first of all, we will discuss the nutrient artery. What is nutrient artery here? Nutrient artery. First, we will discuss the nutrient artery. Nutrient artery. Okay. First, we will discuss the nutrient artery. So this artery enters through the. I already said you that this artery enters through the nutrient foramen. Okay, nutrient foramen. So it enters, here is the shaft of the bone, here is the nutrient foramen. So this artery enters like that and enters through the piercing the cortex and divides into the ascending branch and descending branch. Okay, so this divides into the ascending and descending branch in the medullary cavity. So you know that now, this is the medullary cavity. Okay, so in the ascending branch and descending branch it divides. Okay, so now each branch, if we zoom like that, this is the nutrient artery. This is the ascending branch. This is the descending branch. Okay. So each branch subdivides into number of small parallel vessels which enter the metaphyseal and forms their hairpin loop-like structures. So in this diagram, you can see what you can see here in this diagram. So there is a nutrient artery. I will show from the directed. This is the nutrient artery. This is the ascending branch, and in the metaphysis, and when it enters the metaphysis and forms their hairpin loop-like structures. This is like a hairpin loop-like structures, hairpin loop-like structures. Okay, and after that, it anastomosis the epiphyseal, metaphyseal, and periosteal artery. So this is the periosteal artery. here you call, you can say the periosteal arteries. So it anastomoses with the periosteal arteries, and this is the metaphyseal artery. So it anastomoses the periosteal arteries and periosteal arteries and metaphyseal artery, like that. Okay, so this gives the many a small and parallel branches and anastomose with the metaphyseal arteries and epiphyseal artery also it anastomose. Okay, so this is the basic diagram. So basic diagram uh, you have to draw in your copy. Okay, so what I have said is all written in this slide. You can read. Okay, so it anastomoses with the epiphyseal artery, metaphyseal artery, and periosteal artery. This is the MCQ, and it supplies the inner two-third of the cortex and metaphysis. So inner two-third of the cortex, okay, inner two-third of the cortex and its metaphysis. Nutrient foramen direct away from the. One more important concept is if the you can see in the bone, nutrient foramen is directed downward, means its direction of growth will opposite to the that nutrient foramen. You can remember like that. Okay, so nutrient foramen is directed away from the growing end of the bone. So if we suppose this is the growing end of the bone, so nutrient from one will like that. Okay, it's like that. Like the direction is downward. Okay, opposite to that. Next is periosteal artery. So periosteal arteries, they are found in the periosteum. You can remember like that. Like in the bone we have periosteum, we have epiphysis, we have metaphysis. So all that parts have a single arteries have their own arteries. You can remember like that. So periosteal arteries. Second is periosteal artery. Third is epiphyseal artery. Fourth is metaphyseal artery. So these four arteries supplied to the long bones. Okay, so it is found in the periosteum. One line you can like that. Epiphyseal artery found in the epiphysis. Metaphyseal artery found in the metaphysis. So one line you can write. Okay. So how periosteal arteries enters? They enters through the Walkman's canal. I already told you that Walkman canals are the horizontal canals and vertical canals are Haversian canals. So this is the Walkman canal. This is the Walkman's canal. This is the Walkman's canal. This is the Walkman's canal. This is the Haversian canal. Haversian canal. So this artery enters through the Walkman's canal. Okay, this artery enters through the Walkman's canal. Okay, and supply one third, outer one third of the cortex supplied by the periosteal arteries, and inner one third of supplied by the inner, sorry, inner two third is supplied by the nutrient artery. Okay, so you can learn. So this 3 point you have to write down. Okay, next is epiphyseal artery. Here you can see the epiphyseal artery. You all know that किसको supply करेगा epiphysis को ठीक है it supplies the end of the bone, it supplies to the end of the bone and growing plates. This is what in blue, this is the epiphyseal plate, this is known as growing plate. So if we disturb in any type of disturbance to the epiphyseal artery, it will affect to our bone growth also. So very important concept here. So if epiphyseal artery is disturbed, then it will disturb to the growth of our long bone. So it is derived from the periarticular vascular arcades, and next is metaphyseal artery is derived from the neighboring systemic vessels. Metaphyseal artery is derived from the neighboring systemic vessels and mainly those supplied to the associated joints. So it is mainly supplied to the associated joints. Okay, so this is all about the long bones. So for the short bone, what we have to remember, these two artery, nutrient artery and periosteal artery. Now, nutrient artery, how it enters? It enters the cavity and divide to form the plexus here. Okay, so if we suppose like this is the short bone, and this is the nutrient foramen, and this artery enters the cavity, okay, and divides, forming the plexus like that. Okay, and periosteal artery is a major part of the adult bone and replaces the nutrient vessels. Okay, so this provides the nutrients to the periosteum. Okay, so supply the major part of the adult bone. Understand? So this is the blood supply of the long bone and short bone. You have to write like that in your exam. So this is the long bone. It is supplied by the nutrient artery, metaphyseal artery, epiphyseal artery, periosteal artery, and this is the short bone which is supplied by the nutrient artery and periosteal artery. ठीक है? तो ये तीन आर्टरी है. नाम से याद रखना है. लॉन्ग बोन के पास क्या होता है? लॉन्ग बोन के पास हमारे पास क्या होता है? सबसे पहले तो एपिफाइसिस होता है तो एपिफाइसियल आर्टरी, मेटाफाइसिस होता है तो मेटाफाइसियल आर्टरी। उसके बाद क्या होता है, उसके बाद क्या होता है, डायाफाइजल कोई आर्टरी नहीं होता। न्यूट्रिएंट फोरामेन होता है तो न्यूट्रिएंट आर्टरी। ठीक है, पेरियोस्ट्रियम होता है, पेरियोस्ट्रियम होता है तो पेरियोस्ट्रियल आर्टरी, और वहीं पे उसका डायग्राम आर्टरी भी बना देना है। ठीक है, सेम न्यूट्रिएंट आर्टरी एंड पेरियोस्ट्रियल आर्टरी गिव फॉर्म blood supplied to the long bones. Okay, so this is the 3D diagram. You can imagine in this diagram also. So this is the nutrient artery. I already told you that this is the from the ascending branch, the descending branch. Okay, so this from the ascending branch, descending branch, and after that they are anastomosed with the epiphyseal artery and metaphyseal artery, all like that. Okay, now where is the periosteal artery? Here you can see the, if we zoom like this from this part, you can see the periosteal arteries here. Okay, so you can see there is a connections to the superficial osteons. Okay, so branch of the nutrient artery supplying to the this osteon also. So this is type of overview you can fit in your mind also. Okay, so this is all about the blood supply of the bone, and this is all about the blood supply of the bone. I already told you that the important topics of the general anatomy. These are the important topics of general anatomy. In these topics, I have done the anatomical terminologies where you can the maybe ask the important viva questions also, and general concepts about the anatomy. Okay, so next is the bone supply. I have already done, blood supply already done, and epiphysis already done. Next two points, ossification and types of ossification, center of ossification. We will discuss all these concepts related to ossifications of bone. Okay. Next is joint classification. Very, very important question for long answer question. So you must have to attend this. You have must have attend this video lecture so that you can be good in the joints also. So joints is very important in all chapters. You will study the joints in all chapters like lower limb, upper limb, thorax. So you can these are the basic concept. Joints is the basic concept. So you can apply this concept in the upper limb, lower limb, and thorax also. So you must have remember the types of joints, classifications, and their examples also, so that you can learn the examples in this general anatomy, and this will be good. This will be used in your this will be used in what uh, lower limb, upper limb, thorax. This the units of the anatomy you will use in these units. Okay. So this is all about the general anatomy. So our next lecture is based on the ossification and types and their center of ossifications. Okay. So we will meet in this in the upcoming video lectures. So till you have to study and work hard. Thank you so much. Have a nice day.